On behalf of the Center for Crisis Studies and Mitigation at the University of Manchester, welcome to our weekly seminar series. My name is David Schultz, and I'm Professor of Synoptic Meteorology and Principal Investigator of the Center. Now, the purpose of our center is to bring together different researchers across our university working on natural hazards and their impacts on society. Now, this is the second seminar in our series, and I want to thank Dr. Pon Suvanaseng of our center for selecting the speakers, organizing, and advertising the seminar series. And I want to thank Chris Higson from the University of Manchester Media Services for his assistance in getting us online. As you can see on the screen, we have a great selection of speakers for the next few weeks, and we're working on other seminars beyond this point. So be sure to register for the next week's seminar with Dr. Daniel Elam from the University of Hong Kong, and he's going to talk about Crisis of Empire in Hong Kong, the art of being poorly governed. So that sounds really interesting. It'll be on WebEx, and so we'll have different registration information for that. To stay informed of our activities, find access to the links, please remember to follow us on Twitter at UMCrisisStudies, and check out our website for event updates and video postings as well. The format of today's talk will be as follows. During the seminar, you can enter your questions in the chat box. The questions will be collected and sent to me, and we'll do our best to get to them all during the question and answer session. For now, let me introduce our speaker, Professor Rob DeLeo. He's an associate professor of public policy at Bentley University in Massachusetts. His research explores the political dynamics of agenda setting and policy change, as well as the governance of public risks. His 2016 book, Anticipatory Policymaking, When Government Acts to Prevent Problems and Why It Is So Difficult. This book examines policy change in anticipation of emergent hazards and potentially catastrophic events. His work has appeared in various peer-reviewed journals, including Critical Policy Studies, Polity, Policy and Politics, Policy Studies Journal, and others. Rob is leading one of the University of Colorado in Boulder's COVID-19 working groups for public health and social science research. And Rob's team is currently implementing a National Science Foundation funded project examining risk communication during the easing of COVID-19 restrictions. Professor DeLeo's talk is titled Always Unprepared: How Politics Undermines Disaster Preparedness and What to Do About It. I'll hand it over to him. Professor DeLeo.
Thank you so much, David, for having me here today. It's an honor to talk to everyone. And I think any discussion of disaster preparedness really needs to begin with a discussion of the current COVID-19 crisis. And in full disclosure, I am a student of American public policy, so the lens through which I'm going to discuss the pandemic and public health preparedness, and actually disaster preparedness more broadly, is a US lens. That being said, I think many of the lessons derived from today's talk are relevant in other contexts as well. If you were to look at the US's response to COVID-19, what you'd find is really it's been hobbled by four distinct but very much interrelated factors. First, the current administration, the Trump administration, all but disregarded global disease surveillance warnings. As late as January, there were flashing red signs that the US was on the verge of a crisis, and the Trump administration nonetheless chose to ignore those alerts and flashing red signs, despite the fact that experts in the CDC and other administrations warned that this was indeed a crisis that required immediate attention. Secondly, we've had inadequate domestic surveillance of the disease, and I know that this has been a problem in another number of other industrialized countries as well. We effectively lost the entire month of March to inadequate testing, which meant we had virtually no idea as to the rate of the virus's spread within our population, thus undermining our ability to contain the virus early on. And when it came to containing the virus, we were also suffering from a degraded treatment capacity here in the United States. Everything from a lack of personal protective equipment to a lack of ventilators to even a lack of hospital beds has made it very difficult for the United States to deal with this crisis. And last, but certainly not least, the current crisis has been marked by a host of conflicting and often contradictory messages, especially from the United States national government. At the beginning of the pandemic, we analogized COVID-19 to seasonal influenza, which of course we all know is a very poor analogy. We also urged people to refrain from buying masks. We're now telling every American that they should not leave the house without a mask. So taken together, these four factors have really made it very difficult for us to control this disease. And my argument is, and the argument that I'm going to submit to you today, is that really our inability to control COVID-19 and our inability to adequately test, disseminate information, treat COVID-19 patients, and effectively message COVID-19 risk can all be boilerplated down to really a lack of preparedness within the American health system that in many ways speaks to a problem that's not only medical in nature, but is actually political in nature as well. Now, of course, when it comes to COVID-19 and it comes to public health preparedness, we can trace this lack of preparedness back to a number of very important programs that, not surprisingly, have been underfunded over the course of the last 10 to 15 years. One program that public health officials have begun to mention fairly frequently is the Public Health and Emergency Preparedness Cooperative Agreement. In short, PHEP, as it's called, is a cooperative program that is co-funded by the U.S. national government and state governments. And this particular program is really the primary source of national funding for state public health departments. And that's important because, as I'll note again later in my talk, states in the US really drive most emergency management policy making. We live in a federal system that divides power between the national government and the states, and most emergency management responsibilities are delegated down to these subnational governments. Well, if you were to look at this cooperative agreement, what you'd find is we spent about $1 billion on this program in 2006, and today that number sits at around $600 million. We've also seen cuts in the Hospital Preparedness Program, or HPP program. The Hospital Preparedness Program is a program that's designed to help private hospitals in the United States prepare for emerging disease pandemics. We have a private healthcare system in the US, or primarily private healthcare system in the US, which means most of our hospitals have very few financial incentives to stockpile the types of equipments that you would need to manage a global pandemic event like the COVID-19 pandemic. And so these hospitals rely pretty heavily on the federal government for funding and for help with public health preparedness. And here again, we find that this program has been hobbled by cuts. In 2010, it was funded at a rate of about $390 million, and now that number has dropped to about $225 million. But the real story behind COVID-19, in my opinion, is not just a story about public health preparedness. It's a larger story about disaster preparedness more broadly in the United States. And if we were to look outside of the public health domain, what we would find is that preparedness or activities that are aimed at readying societies for potential emerging hazard events are typically underfunded in the US and typically not seen as items that are very politically salient. So the slide I have presented for you here is basically an aggregate of emergency management spending in the United States between the years 1985 and about 2008. This is actually the most recent comprehensive study of that. And what the study revealed was that during this period, the US spent about $82 billion on disaster relief programs, or programs that are aimed at helping communities recover from disasters that have already happened, in a mere $7.5 billion on preparedness. Well, those trends, other studies have suggested, are actually pretty consistent with what we find on a global stage as well. So a study published in 2014 revealed that close to 95% of all global emergency management expenditures go to post-disaster activities, whereas a mere 5% tend to go to pre-disaster activities and preparedness. Now, you may be saying to yourself, so what's the big deal? Disasters cost a lot of money. They're expensive. They inflict all sorts of damage on communities. Why is it necessarily surprising that we pour all this money into recovering from them? And I would argue that the absence or dearth of preparedness funding is really problematic for two primary reasons. One, preparedness saves money. Preparedness has an excellent return on investment, or ROI. So a recent study suggested that every $1 spent on disaster preparedness results in roughly $7 in immediate savings and upwards of $15 in savings in terms of the future damage that it mitigates. So when we invest in preparedness, we're really investing in programs that are not only going to have an excellent return on investment in the short term, but over the course of several years, we'll continue to recoup that investment and actually result in future savings. More importantly, as COVID-19 has shown us, preparedness saves lives. It was really a lack of preparedness, an inability to survey, a lack of treatment capacity that has driven the US's inadequate response to this virus. So by investing in preparedness, we're really investing in public health and safety. And I would also add that the notion that you can have an effective disaster response or relief effort without investing in preparedness is simply not true. The question thus becomes, where does this come from? Why is it that despite the fact that preparedness has an excellent ROI, despite the fact that most students of disaster policy would tell you that preparedness saves lives, why is it that American policymakers, and indeed policymakers in general, don't tend to invest in these types of pre-disaster activities? And if you were to look at really the last 2 to 3 decades of research, I think what you would find is the drivers. There are 3 really important drivers of the lack of preparedness, and you could call these sort of 3 overriding barriers to preparedness. The first is psychological. And what I mean by that is, as humans, we are typically conditioned to learn through trial and error, meaning we experience some sort of event in our lives, whether it's a political event, whether it's a disaster, whether it's a personal event. And from that event, we derive lessons that then cause us to either change our behavior or change our policies and programs. So I live in the state of Massachusetts, in the city of Boston. And if you were to look at the budgets of almost any municipality in the state, indeed in greater New England, what you would find is that they set aside a fairly modest amount of money every year for snow removal. And they do this because they can predict with not necessarily certainty, but within a high probability that in any given year, they'll have anywhere between 1 and 5 fairly large snowstorms that will necessitate that state and local public works departments remove that snow so roads can be safely traversed. The problem with many disasters is that we often think of them as low probability but high consequence events. If you were to think of COVID-19, COVID-19 is often analogized to the 1918 influenza pandemic or the Spanish flu pandemic. Well, that was more or less a 100-year event. So in the absence of prior experience with disaster, it's incredibly difficult to motivate politicians and to motivate voters to care about things, to care about preparedness, because it often means preparing for events that they have no prior experience living through or dealing with. Another factor that undermines preparedness in the United States is structural. As I alluded to in the introduction of my talk, the US has a federal system of government that divides powers between a national government and the states. Most emergency management responsibilities are delegated to the states. And this is a useful way to respond to disaster because, of course, states are closer to the people. They have a better understanding of the hazard profile of their particular jurisdiction. Some have argued that states and indeed local governments are better equipped to respond quickly to disaster. But when it comes to preparedness, this arrangement is problematic for 3 reasons. First, the American states differ, oftentimes quite dramatically, in terms of their level of professionalization. So whereas some US states will have highly sophisticated, highly developed public bureaucracies that have received modest amounts of money for emergency management and public health preparedness, other states will only make marginal investments in these things. Secondly, all states struggle from the fact that they have very limited resources. If you were to look at the budgets of most state governments, what you would find is as much as 1/3 of that budget every year is allocated to large federal social welfare programs. And these programs are absolutely critical to providing a safety net at the state level, which no doubt helps us respond to disasters, but it also means that they have fewer resources that they can move around and invest in preparedness. And then finally, many states don't even track their preparedness spending. There was a fantastic study that came out by the Pew Charitable Trust in 2018 that found that really only a handful of states even have a sense of how much money they spend on emergency management to begin with, let alone differentiating between relief and preparedness spending. So in the absence of this data, it's very difficult for states to make informed decisions about the extent to which they are in the first place prepared and what they need to do to make sure that they are continue to be prepared going forward. But in my opinion, of the 3 factors that influence or that serve as barriers to effective preparedness policy, none is more important, none is more pressing than the third, and that is politics. Simply put, one could argue that the reason politicians don't invest in disaster preparedness is because, quite frankly, voters don't reward them for doing so. There was an excellent study that came out in 2008 by Andrew Healy and Neil Malhotra, two political scientists, that found that politicians, incumbent politicians, who are able to distribute relief money back to their district after a disaster enjoy a higher vote share in the next election. By contrast, incumbent politicians who are able to secure preparedness money saw almost no change in the polls. What this means is, if you are an elected official, you really have no major political incentives to invest in disaster preparedness, because as a point of fact, your voters probably aren't going to reward you for it. By contrast, waiting for disaster to happen allows you to distribute what we in political science call pork barrel spending back to your district, or district money that's very visible, very politically salient, and something that you can run on in the next election. Why is this the case? Why do political scientists believe preparedness lacks the same level of salience as disaster relief? Really, there's sort of two reasons that have been proposed. One, preparedness lacks observability. So whereas if you are someone who receives relief money after a flood, that's something that has a very clear, very tangible impact on your life. A successful preparedness system is one that we actually don't know is working. So if you live in a coastal community that's protected by a jetty or a beach wall or a marshland, it's very unlikely that you will look at those systems and say, gee, I'm really happy that that beach wall prevented flooding last year. You may not even be aware that that beach wall is working at all. So in the absence of observability, it's very hard for incumbent politicians to make the case that those investments in preparedness had an immediate, tangible impact on voters' lives, especially because most voters at the end of the day are really myopic and are only going to pay attention to a handful of things that had an immediate and measurable impact on their lives. That's why the economy is such an important driver of voter activity. Secondly, and relatedly, when we think of most preparedness program, we're thinking of public goods that are delivered collectively. So the dam, the levee, the beach wall, all of those things are things that we as a society enjoy in common. We commonly benefit from that. Relief programs, by contrast, can be delivered on an individual basis. So the example of flood insurance money is a great one. When you are stricken by a flood in the US, the federal government can provide you with insurance funding to help offset some of those losses. So if your home is damaged, that's money that's going into your individual pocket as a consumer. We also saw this in the case of COVID-19. The United States Congress passed the CARES Act, which actually provided individuals and households in the US with a check that could help stimulate the economy and help them during this time of unprecedented economic crisis. So to summarize, what has the literature told us, or what do we think we know about disaster preparedness based on the literature. And notice that I'm emphasizing the word think because I believe there's actually a few problems with these studies, which I will address in the second part of my talk. Well, first of all, as noted above, there's various barriers to preparedness. We can think of those barriers as being psychological. We can think of them as being structural, namely federalism. And we can also think of them as being political. Secondly, we're also told that voters don't reward preparedness, which means that politicians and elected officials have very little incentive to invest in disaster preparedness. And if we were to take all of these findings sort of in aggregate, what we could pretty safely say is that the political system is a reactive one. It's a system that is designed to respond to disaster as opposed to anticipate, mitigate, and ideally prevent disaster. So taken together, the literature leaves very little hope for change in how we go about dealing with disaster and ideally investing in pre-disaster activities. There are, however, three problems with this research, and there's three very important questions that we really don't know the answers to as political scientists and policy scholars, and perhaps more broadly as social scientists. First of all, despite decades of research into the political dynamics of disaster preparedness, none of these studies have actually directly queried the perspective of elected officials and voters alike. And what I mean by that is most of our assumptions about why voters don't support preparedness programs or why elected officials don't invest in preparedness are based on studies that rely primarily on election outcome data. So we'll look at spending trends over the course of the last 4 years, and we will use those trends as predictors of an incumbent's vote share. And while those studies are no doubt important and have done a great job advancing our understanding of the political dynamics of preparedness, they've really prevented us from unpacking the decision nexus that's involved with legislators who are forced to vote on preparedness and the decision nexus of individual voters. This means that we haven't been able to fully assess which of the various barriers has the greatest impact on voters and elected officials. And I would argue, most importantly, what, if anything, can be done to overcome this problem? In other words, are there any strategies that we can use to incentivize voters to care more about preparedness and incentivize politicians to invest in preparedness? And this is where my own research comes in. And if you recall, the title of this talk noted at the end what to do about it. So what can we do about our lack of adequate investment in preparedness policy? And in the face of these shortcomings, I launched a nationwide survey of state legislators and voters in collaboration with my colleague Sarah Anderson of the University of California, Santa Barbara, and Kristen Taylor of Wayne State University. We sent the survey to every state legislator in the US, as well as a sample of voters. Our survey was sponsored by two nonprofit organizations that work very closely with state legislators and their staff, which was important because anyone who has tried to survey elected officials know that it's very hard to get them to respond to these types of queries. The first organization we partnered with was the State Legislative Leaders Foundation, or SLLF. And they basically work with the leadership within state legislators to help them develop their careers and leadership skills. So people like House speakers, Senate presidents, committee chairs will all work with SLLF. And then the National Conference of State Legislators, which is a much larger organization that works with all state legislators and their staff. So our first round of surveys went out in the summer of 2017. We only focused on state legislative leaders, and about 50 of them responded. In 2018, we then sent our survey out to rank and file members of state legislatures and received about 414 responses. And then the third round went out in 2019. And in this instance, we targeted voters, and we used Amazon's Mechanical Turk to distribute that survey and got an N of about 1,000. So before I report some of the results to you, I want to talk about our survey instrument, because it's very important to understanding how our design differed from those designs that came before us, and why I think it may provide a path forward for people hoping to incentivize politicians to make greater investments in disaster preparedness. So what we wanted to do with this survey was we wanted to simulate the decision nexus of an elected official or a voter who is asked to think about emergency management policy within their particular state. And to do this, we used a 2x2 experimental design. First, we assigned all survey participants to a group that was either asked to consider the preparedness budget of the emergency management agency within their state, or the relief budget of the emergency management agency within their state. So everyone was initially sorted into either a preparedness or a relief group. And in all the subsequent questions they received in our survey, they were either asked to consider questions related to preparedness or relief. We then took those two groups and we sorted them into another two groups, and participants were randomly assigned to receive one of two scenarios or vignettes. The first scenario described disaster losses within a state over the last 10 years. So we would say something like, over the course of the last decade, your state has lost X millions of dollars in response to flood events, tornadoes, hurricanes, whatever the disasters may be. So we asked them to look retrospectively at losses occurring in the past. The other group received a very similar scenario, except instead of asking them to look retrospectively, we described a scenario that asked them to look prospectively. So what we did was we described expected disaster losses over the next 10 years. So your state is anticipated to lose X millions of dollars as a result of disasters over the course of the next decade. So what you can see we're trying to do is we're both varying the policy context within which people are making decisions, either preparedness or relief, but we're also varying the temporal context in which those decisions are being made, thinking about the past or thinking about the future. And what we're trying to do with this experiment is get at, how do we vary messages in order to incentivize people to think more about the future in these different contexts. So based on this information, we then ask them to use a slider indicating their preferred spending levels of different groups within their state government. So how much do you think the governor would want? How much do you think the state legislature would want? But then we also ask them to say, how much money would you want to allocate on preparedness or relief based on these scenarios that we've presented for you? So the literature would tell us, based on what I presented to you above, that neither legislators nor voters should be particularly interested in disaster preparedness. The literature would tell us that they're myopic, that they're reactive, and when they're faced with an opportunity to allocate money for these two things, they should overwhelmingly allocate more money for relief than preparedness. That is simply not what we found in our survey, however. So if you look at the panel on the upper left-hand side, this is reporting the results that we got from legislators based on their preferred percentage change in either disaster relief or preparedness spending within their state. And it's notable that legislators indicated to us that they would like roughly a 249% increase in preparedness and roughly a 256% increase in relief. So consistent with the literature, yes, they want slightly more for disaster relief money, but the gap is nowhere near as large as what we would expect given the fact that disaster relief funding in most states outpaces preparedness by 8 to 10 times. So this is nowhere near that, and actually they still wanted to increase preparedness spending. Even more interesting, if we look at the panel on the upper right-hand side, what we find is voters actually have a greater appetite for increases in preparedness spending than they do increases in relief spending. So on average, voters indicated that they would prefer roughly a 639% increase in preparedness spending compared to roughly a 622% increase in relief spending. And when we varied, when we looked at differences across the two vignettes, so people who were told stories about past disaster losses versus future, overwhelmingly for both voters and legislators, when we described previous or past losses, they allocated more money for both relief and preparedness. So narratives communicating previous losses appear to be a better motivator of getting politicians and voters to think about spending money on emergency management in general. And that's an important point I'll refer to. I'll come back to in a moment. The bottom panels, the two bottom panels report both perceived and reported voter attention. And when we look at these panels, I think we begin to get a sense of where the breakdown comes with respect to politicians investing in disaster preparedness. So if we look at the bottom left panel, what we're asking legislators here is how much attention do you believe your voters or your constituents pay to disaster preparedness versus relief? And overwhelmingly, they indicated, elected officials indicated that they believe their voters pay more attention to disaster relief than disaster preparedness. So that's consistent with what the literature would tell us. But when we ask voters, how much attention do you pay to disaster relief versus disaster preparedness, the two amounts were roughly equal. There was really no observable differences, as you can see in the panel that's on the bottom right-hand side. So what's going on here? Why is it that we have voters that are expressing interest in disaster preparedness, but legislators who don't seem to be aware of this and are not, what I would argue, taking advantage of it? The figure I have presented here is demonstrating results from a simple ordinary least squares regression that effectively allows legislator responsiveness to voter preferences to vary depending on their perceptions of voter attention to preparedness versus relief. So what we're measuring here is the average marginal effect of a voter's attention to relief versus preparedness on legislator decision making. So if you think that your constituents are paying attention to preparedness, how will you vote? How will you behave? Versus if you think your constituents are paying attention to relief, how will you vote? How will you behave? And I think this figure pretty much nicely encapsulates where the breakdown comes. If we were to start with the line looking at disaster relief, what that line is basically saying is that legislators who think that their constituents are very attentive to relief would implement roughly 80 cents in additional spending for every $1 per capita that they think their voter wants. So in other words, if they believe their voters are very attentive to relief, they will effectively match that attentiveness with one-for-one spending. So they are very responsive to voters who are attentive to relief spending. Contrast that against preparedness. When legislators believe that their voters are very attentive to preparedness, they only implement roughly a 35% increase for every $1 per capita that their voters want. So they are much less responsive to voters who are very attentive to disaster preparedness. In other words, voters may want to reward politicians for disaster preparedness, but politicians don't appear to be giving them an opportunity to do so. So there's space for elected officials to invest in these programs. They're just not taking advantage of it. Which leads to some conclusions that I think can be derived from our study about ways in which we, people who I would assume are proponents of pre-disaster activities, can incentivize politicians and incentivize voters to begin to move the needle in favor of greater pre-disaster spending and preparedness. First, as noted previously, when you use narratives that describe past losses, legislators and voters will tend to be more responsive than when you describe narratives that present hypothetical or future scenarios. So in framing preparedness, although it is future looking, we are behooved to frame it in terms of the past and not the future. So models about anticipated outcomes, predictions that are based on hypothetical scenarios, those are not things that appear to resonate with elected officials and voters. Instead, by anchoring our narratives in things that have happened or occurred in the past, we appear to have greater traction with elected officials and voters in stimulating attention for disaster preparedness. So when we think about this within the context of COVID-19, we will eventually move through this crisis, but this is certainly not the last public health crisis that we will face. It does, however, provide an excellent frame for referencing the need for future investments in disaster preparedness, because we can remind elected officials of the damages caused by the lack of investment in this context. Secondly, although I've spent my entire presentation drawing sharp distinctions between disaster relief and preparedness, I would argue that when we talk about these two things to policymakers, we really shouldn't differentiate between the two. If COVID-19 has taught us anything, it's that you can't have effective disaster relief without effective disaster preparedness. So the notion that disaster policymaking is truly cyclical is being borne out in the context of this crisis. So in framing the two to politicians, we are behooved to just think of emergency management as this larger slate of activities that cannot occur effectively unless we make investments at the front end in preparedness. And then finally, clearly, politicians are not investing in preparedness because they don't believe that they'll be rewarded for it. So it behooves us to begin to invest in programs that can lend themselves to legislative credit claiming. One of the problems with preparedness is this notion that it lacks observability. But by highlighting for politicians the ways in which these programs are both observable at a district level, at a state level, and even at a national level, we can go a long way towards incentivizing them to invest in these things. I think climate change adaptation is case in point. Many of the climate change adaptation projects in the built environment, for example, things like seawall restoration, restoring marshes or wetlands, these are all things that legislators can claim credit for. They're also things that really should be visible to voters, provided we provide legislators with the tools to point these things out to them. So taken together, I believe that these three steps can help incentivize greater preparedness, assuming we are able to engage politicians in discussions about emergency management spending more broadly. And I would say that never before has there been greater public discourse on preparedness than this moment in history. So it's an opportunity for us to take advantage of and hopefully begin to move the needle in favor of greater investments in pre-disaster activities. Thank you so much, and I look forward to your questions.
Great. Thank you, Rob. Very fascinating, very wonderful talk. Thanks for hitting all those points. We haven't got any questions yet, but I'll ask this one here. Why do you think the literature has offered this view that preparedness is less preferred than relief funding? What's the disparity between what the previous literature found and yours? Is there an explanation for that we can take away?
Yeah, I mean, one of the things that that my colleagues and I believe is that it's largely a testament to the methodologies used in previous studies. It's very difficult to get a response rate above 3% if you're sending a survey out to elected officials. That is sort of the norm. And so for many political scientists, there's a reluctance to invest your time and energy into these surveys because you get very little bang for your buck. So I would say that a focus on voting outcomes is useful because at the end of the day, it's demonstrating revealed preferences. But we believe that it's too blunt of an instrument to really unpack a way forward, which is why we chose to forego a large N in favor of actually going to the source itself and distributing our survey.
And do you think that this perception that's out there, I mean, do policymakers actually believe that as well, that it's to their benefit to go after relief funding rather than preparedness funding? And do you think, and if so, has that hurt turning this ship around, so to speak?
Absolutely. I mean, our survey, you know, what's fascinating is our survey in some respects is consistent. Policymakers don't believe that their voters pay all that much attention to preparedness. And even when they are attentive, even when they think their voters are attentive, they're still not giving them an opportunity to reward them for preparedness. And so I think that this notion of a reactive electorate is very, very much ingrained in the American political psyche. And I would argue the political psyche in many industrialized democracies. And so, yes, I think elected officials are very aware of this. I think they themselves are reactive in part because they're lurching from election cycle to election cycle, where they're just trying to cobble together, keep their coalitions together. And they do that by distributing goods and services back to their district. So it's actually quite fascinating here in the US to see a Republican Congress vote to send checks to every American taxpayer below a certain income threshold. I think that says a lot about how elections can sort of change perceptions of social programs.
And then continuing that, we have a question from Miguel, who asks, what advice can you give us if we want to work with politicians to change, you know, to favor these kind of long-term actions? Is, you know, when there's a role for short time compared to the long return period that disasters take, how do we get them motivated on these issues?
Yeah, so I would say two things. One is in another study that came out of this survey, we looked at the role of experts in shaping legislative decision making at a state level, and you know, first and foremost, legislators, especially at the state level, typically have very little technical knowledge about emergency management more broadly. And I think that that's actually part of the problem because emergency management departments in many states are really small. In some instances, it's 2 or 3 people. So first and foremost, providing them with clear and consistent information about the value of preparedness, we've shown can get them to introduce legislation favoring disaster preparedness. And that study's available through the Policy Studies Journal if anyone wants sort of empirical evidence of that. Secondly, I would say that if you want to engage politicians on preparedness now, I hate to say take advantage of this crisis, but reminding them of the damage done by the lack of preparedness for something like COVID-19 can go a long way towards getting them to think about investing in these programs. So the 2 programs that I mentioned at the beginning, HPP and the PHEP cooperative agreement, you know, those are very easy programs to invest in for politicians. They already exist. And so to be able to point to them and how that resulted in a lack of personal protective equipment, ventilators, emergency beds and stuff like that can go a long way towards incentivizing future investments.
And we have a question from Marcella about framing preparedness. It is interesting to rethink it about the past and not the future. I was curious to know your perception about whether framing the narratives about disasters in numbers would be more salient or relevant than framing narratives with oral stories in order to incentivize action to preparedness.
That is a great question. So as part of a survey we have in the field right now looking at individual perceptions of COVID-19, the data is very preliminary. Our first wave of surveys just went out, but we actually asked survey participants to recall any memorable messages that they may have about the pandemic. And what we're finding is that those stories, those narratives are much more salient than just the raw data communicating trends. There's a rich literature out there on the narrative policy framework that has shown the way in which the ability to communicate an effective story is much more persuasive than just providing raw data and numbers. So I would say that stories are a much better a vehicle for communicating risks and preparedness than raw data.
Elisa asks, what do you mean by preparedness? Do you have some examples? And to kind of embellish that point, do you have some examples that you know were very successful, that overcame this huge barrier to, you know, versus relief funding, obviously?
Yeah. So in the survey, we actually defined preparedness and relief for the survey participants, because we worried that many people may not be familiar with this technical jargon, even people who are in a state legislature. And we broadly defined preparedness as pre-disaster activities that mitigate the risks associated with emerging hazards, and we provide examples of levees and dams and things of that nature. Happy to share the exact language. I can't recall exactly how in plain English we defined it off the top of my head, but we broadly define preparedness as pre-disaster activities. And as far as success stories go, there are some curious success stories for disaster preparedness in the US. The example that comes to my mind was the US's response to the H5N1 avian influenza or bird flu around between the years 2003 and 2005. This, as some of you probably recall, it was believed that the next great pandemic would be an influenza pandemic, not a coronavirus pandemic. The H5N1 flu, fears about the flu, started shortly after the September 11th, 2001 terrorist attacks in the United States, where there was a great deal of concern among the Bush administration about what we broadly defined as homeland security. In anticipation of that event, the Bush administration and Congress actually allocated billions of dollars into a preparedness program. They also passed legislation that made it easier for the US to manufacture vaccines and delegated EM authority to the Secretary of Health and Human Services. Why was that such a great success? I would argue the reason is twofold. One, as I noted before, we viewed that emerging hazard through a 9/11 lens, which for some people in the public health community was troublesome because it meant that we securitized lots of public health functions. I was actually working in public health around that time. But it also meant that it was something that was salient to policymakers. It was seen as an extension of a larger threat to homeland security, which gets to this idea of framing in terms of the past. And number two, there was what we call in the policy sciences a policy entrepreneur in the Bush administration who was the Secretary of Health and Human Services. And he was almost obsessed with the prospect of another great influenza. There's a rumor that he actually bought copies of John Barry's book 1918 for every member of Congress who sat on a committee with jurisdiction over health. and he highlighted and doggy-eared the different sections in the book that analogized the 1918 pandemic to a potential avian influenza pandemic. And that really that personal touch really resonated with policymakers. So I would argue a good policy entrepreneur coupled with effective framing was key to that. And really it was that planning that helped the U.S. navigate the 2009 swine influenza.
Great. So one final question. Obviously you worked a lot in the United States in the context there, but many of our audience, and of course the host organizations are in Europe. Do you have any thoughts about I'll let you freeform it here, but differences between US and European politics in this regard, the things you've been talking about, or do you see particular advantages in Europe or disadvantages, weaknesses that we have in Europe relative to the United States that may inhibit or promote, better balance between relief and preparedness spending?
Well, that's a great question. And I would say it depends on which countries, European countries we're talking about, because one of the fascinating things about COVID-19 in particular, right, is it's revealing the extent to which differences in EM systems are truly, they're very much rooted in differences that occur at a national level. So one thing that I think that the current crisis has revealed is that basic managerial competency still matters. Unfortunately, in the case of the UK, like the United States, it seems that among some of our national leaders, basic managerial competency was lacking, especially at early critical stages in the pandemic. So as much as I would like to say that we can invest in programs that will protect against that in the absence of effective public health messaging, I think it's very hard to overcome leaders who are contradicting best practices within your state. So that's point one. The other takeaway is I think that countries that invested in surveillance are really countries that appear to have a leg up in this context. And I would say that that extends not only to public health threats, but a host of emergency management more broadly. One of the things that concerned me most about our current administration was that aside from the fact that it has struggled around messaging, it's also defunded programs that collect climate data, flood data, data on global health crises. And while we think of data as being this sort of academic enterprise that has little value beyond the academy, what we're learning now is that in the absence of good data, it's really difficult to make good decisions. So my hope would be that we learn from those European countries that had robust testing and surveillance early on, and we hopefully try to replicate that in the US and maybe in the UK as well.
Great, Rob. That's all the time we have. So again, thank you very much for your wonderful presentation, very enlightening. And just to remind all the listeners, next Tuesday, June 2nd, we've got Crisis of Empire in Hong Kong, The Art of Being Poorly Governed by Dr. Daniel Elam from the University of Hong Kong, and hope to see you there. Again, thanks to Rob, and have a good week, everybody.
Thanks for having me.
Take care.